Welcome to COVID Q&A, your questions, our answers. Today I'm sitting down with Dr. Doug Drevets, Regents Professor and Chief of Infectious Diseases on the HSC campus. Thank you for joining us today, Dr. Drevets.
Thank you for having me, Darcy.
The question we have for you today is, if I fly to Mexico for vacation, can I come back to work if I prove I have the COVID-19 antibodies?
Well, the answer is maybe. You also need to do a whole variety of other things to keep yourself protected, such as wear a mask and practice good hand hygiene and social distancing. And the mask is going to be particularly important when you're on public transportation going to and from Mexico and when you're there. The issue with the antibodies is we still don't yet know exactly what they mean in terms of your ability to acquire and transmit virus. That is being studied very intensely. There are vaccine trials that are starting this summer. So I anticipate that within 6 to 8 months, we will have a better answer. But for right now, it's just not clear what the antibody tests mean. It also depends on what kind of an antibody test you get. Some suppliers and manufacturers of these tests do not have good quality control, and they don't have good, what we call specificity for COVID-19 specifically. For example, there are at least 4 other related coronaviruses that can cause regular colds. It is possible if you have one of the tests that can't distinguish between those, you might think you have antibodies to COVID-19, but all it's saying is that you have an antibody response to the common cold that you picked up last fall. We just don't know. The other thing about the COVID-19 antibody test, we don't know how long that is going to last, even if it does have protective capability. For example, let's say you did have COVID-19 infection in March, were found to be antibody positive in April. We just don't know yet if that means you're still going to be antibody positive in October. So just more to come on the antibody testing. It's a very fascinating field. There's a lot of research going on in it, and I expect that in 6 months to 9 months, we'll have some different and better answers for you.
Awesome. Well, thank you for that insight, and thank you all for tuning into this week's COVID Q&A.